Well, welcome to our July 8th meeting. Tonight we're going to be talking about RT career paths for our RT student club meeting. And we are joined tonight by our dean, Ken Wicca, Daryl Goliford, myself, Sean Matheson. And I see that we have on the line here, I should just ask your first name. I see your handle here of TShy718.
Yes, it's Tisha Isaac.
You've been with us
Tisha
before,
Isaac.
haven't you?
Yes, I have.
Welcome back. Good to
Hi,
have
how are
you.
you?
Very good, thank you.
Very good.
We appreciate you being with us tonight, Tisha. And where are you located?
I'm in New York. New York City.
And I'm in Lake
That's
George,
right.
New York.
Oh, love Lake
Shy.
George. Very
And
nice.
so good to have you with us.
Thank you.
Tisha, we appreciate you being here. So Tisha, please ask questions as we go along here. And if we have other students join us this evening, we'll welcome them in as well. So tonight we're going to be talking about RT career paths. And we have a great agenda of content set forward here. Ken can go through some announcements, and then we'll be sharing, Ken, Daryl, and I, the different paths and options for you as an RT in your career. So with that, Tisha, we'll go ahead and get started. Ken can kick us off here with any general announcements.
Tisha.
Yes.
I is my last name.
Tisha, okay. Tisha, are you working or are you still a student? Oh, what's your first name?
My first name is Tisha.
Tisha. Okay, Tisha, are you working or are you still in school?
I'm still in school.
Okay.
I'm doing the last two semesters, the last 2 months now.
Oh, well, we want you to get to that finish line so you can graduate and pass your exam and continue on with your career. Sean has me down for announcements. You know, the program is accredited right now by COARC.
Yes.
And we are ready to submit our annual report by September 1st. And if things go along as planned, in the near future, we'll be offering a bachelor's degree entry level. But for you, Tisha, you can continue on with our BSRT completer program. And you could either take the management track or you can follow the clinical practice. Either one will bring you to a bachelor's in respiratory therapy.
Okay, now I was asking my my preceptor about the bachelor's because I already have a bachelor's in health science. I have to get a bachelor's in respiratory care.
No, you don't have to. If you already have a bachelor's, that's fine. This is offered to those who have an associate's degree or registered or certified, but they want to get a bachelor's in respiratory therapy so they can enroll in our program. Yeah.
So, because he was saying it's not necessary to get a bachelor's in respiratory if I already have a bachelor's.
That's true.
Okay. Now, is there a master's program in respiratory?
The only one I know of is in Buffalo, New York, Canisius College.
Okay. Okay. All right.
There's others throughout, but since you're a New Yorker, in Buffalo is Canisius College.
Gotcha. Okay. Thank you so much.
You're welcome.
All right. I'll mute myself now.
Okay. Let Sean take over. Those are my announcements. We're planning on getting that program approved and off the ground, and we are accredited. So.
Well, thank you for those announcements. And Tisha, please feel free to stay off of mute if you'd like. We'd love to make this as interactive as possible and be able to ask you questions as we go along here. Make this as valuable for you and for anybody as possible. Okay. We'd like to start this presentation out with a slide here.
I can't see the bottom right.
Yeah, we've got this. Oh, you can't see it? Okay.
Can't see it.
That's not coming through. Okay. Yeah, this is a slide I've got for you. Steps of becoming a registered respiratory therapist. Just a level set here.
So I guess that's me, right, Sean?
Yeah, can you see the rest of the slide okay? The degree, TMC exam.
Yes,
Right, I
yeah.
can see that.
Okay, great. Yeah, if you could just walk us through that, and then I'll just announce the slides if they're of
Sure.
who, you know, Ken or Daryl
Yeah,
going forward.
to become an RRT, what you need to do is, of course, complete the program. So that means you complete the didactic and clinical components. And once you graduate, you'll be eligible to take the therapist multiple choice exam offered by the NBRC. Now, if you get the low cut score, you'll become a certified respiratory therapist, which is 86 points or higher. Actually, 86 is the low cut score. But if you get 92 or higher, that's the high cut score. And that means you're now eligible to take the clinical simulation exam. And that you work with Daryl, he has a review sheet, and you become if you take that exam and pass it, you are now a registered respiratory therapist. Regardless of, usually once you pass either the lower or high cut score, most states will allow you to become licensed in respiratory therapy, except there's about 6 right now. It's California, Arizona, Ohio, New Jersey, Oregon, and I think possibly Pennsylvania. You need to have the RRT in order to get state licensure. So 6 states right now that require the RRT. All the others require the CRT credential, which is the low cut score, and you can get licensed. The only state that doesn't have a license is Alaska. And usually to maintain your credential, whether it's a CRT or RRT, you have to have continuing education units. And that also applies to state licensure. So once you get licensed, they're going to tell you that every year, where it depends on how often you get relicensed, it could be every 2 years, every 3 years, you'll have to have so many CEUs. They usually average about 10 per year. So you do that by going to webinars online, or you go to meetings. Right now, there's a lot of meetings are not being held, so they are accepting virtual attendance. So that's it. Tisha, do you have any questions?
No, not yet.
Okay.
Daryl, I'm not sure if you're able to
sure.
see the bottom right of the screen.
Yes. Yep. How about I'll take this slide. RT is certainly one of the most rapidly growing professions in healthcare, and that relates to the baby boom. I happen to be in the age group, perhaps Professor Wyke is as well, that we're considered baby boomers. There were so many Americans born right after World War II, and we're all getting older together. This has caused a tremendous need for respiratory therapists, because so many of us, as we get older, have respiratory or cardiac problems, and that's what respiratory therapists treat. Additionally, the COVID pandemic has raised worldwide awareness of respiratory therapy and just how essential it is. So this is a great time to enter respiratory therapy. We generally see students who have jobs lined up well before they even graduate. So it is a great profession to enter. I think we're ready for the next slide.
And
Great. And I see that we've had somebody else join us here. Carmen Barker, is it?
Yes, that's correct.
There you are. Hi, how are you?
I'm good. How are
welcome,
you?
Carmen. Good. How you doing?
Yes.
I'm good. How are you?
Fantastic.
Well, we're grateful you're here, Carmen. And we also have with us Tisha
Carmen,
Isaac.
Hi, how are you?
Carmen, where do you live?
In New Mexico?
Okay. How's the weather out there?
Oh, it's dry as a bone. It's so hot.
Sounds like Oklahoma.
Well,
That's
welcome.
where I'm at.
And I'm in New York State, and as Tisha is in New York City. Question, are you a student or are you working?
I'm a student.
Okay. I'm glad to have you here this evening.
Thank you.
Carmen, how close are you to finishing the program?
So I was supposed to graduate next month, August 15th. But with COVID and clinical, they shut down my clinical site. Now I'm supposed to graduate in November.
Okay. All right. We will help you get to the finish line. I'm sure it's
We'll get you to
aggravating
the
to have that delay. Wow. Yeah.
It is.
Okay, I see the slide now, Sean. So it's Faye. She's not here, so I'll take it. Is that the rotation,
Perfect.
Sean?
Yes, yes, that's the rotation. We'll run you, Daryl, myself. That
Okay.
will be perfect.
Okay. Besides getting your CRT and RRT credential, once you're in the field, you can take specialty exams, and you can get other credentials that you can use in your job. The adult critical care specialist or specialty is the ACC designation. And usually you're an RRT-ACCS. You'll put that after your name. So they know that you're not only a registered therapist, but you are also an adult critical care specialist. And this exam goes above and beyond general respiratory care. And they look at different competencies that you would have or be able to perform on adult patients in the critical care area. It's a badge of distinction. And you do have to pass the exam. So the MBRC does give you the format, what to study, how to prepare, and then you sit for the exam. Again, you have to be an RRT to do this, and it's administered by the NBRC, the National Board for Respiratory Care, and their website is noted on the slide. So you'll be able to go for this once you get your
Very
RRT.
valuable. Let me
Any
comment
questions?
quickly. Professor Wyka, I'm actually one of the exam writers for the ACCS exam. We all gathered in Kansas and created this exam a few years ago. Critical care adult specialists from all over the country. It's a very valuable credential. Here at our own University Medical Center in Oklahoma, it brings a $5 raise, which is $10,000 a year once you get the ACCS credential. So that's how valuable it is.
And again, Daryl, that's a good point to make, because depending on where you live and work, it might be maybe a little bit less than that, or it could be more.
Exactly.
The monetary.
Exactly. All right. So I'll talk about the NPS credential. That works because I teach pediatrics here at my own program in Oklahoma. The NPS is very important if you want to work in a NICU, neonatal intensive care unit setting. And it turns out that really quite a few of our graduates do select that setting. It's a special place, the NICU. These premature babies who just 20 years ago probably would not have survived are now surviving. And that's largely because of respiratory therapy and a magical substance called surfactant. I happen to be involved in the early trials in Children's Hospital, Columbus, Ohio with surfactant. And we could see very quickly that it was going to make a huge difference. It has. So there's a detailed content outline for the NPS exam. The pass rate is actually quite high. Because generally people who work in the NICU find themselves well prepared for this exam. Again, there's usually a significant financial reward, but it's also a step to getting to the job you want. And that's kind of an important aspect. That if you want a particular aspect of the profession, you want to be the expert, and you show that with this kind of exam. I think that's all I have on NPS. Any questions about NPS? Okay.
And Daryl, perhaps you can take us through CPFT as well.
I'll do it. Yeah. I would like you folks to know that the gentleman in attendance tonight, Ken Wyka, is the writer of the chapter on pulmonary function testing in Egan's, your Bible of Respiratory Therapy. So we have the guy who literally wrote the book is here. There are two cut scores.
Excuse me, Professor Guilford. I wrote the chapter on home care.
Oh, I'm sorry, sir. Not PFT.
I could, but
I love that. I could. All right.
And rehab. Mine was home care. And rehab.
Okay, very good, sir. I'm confused. But there are two
Thank you.
cut scores, you betcha. The certified pulmonary function technician, the registered pulmonary function technician. You have to first be an RRT to go take that exam. But it is a valuable thing to have if you want to work in the pulmonary lab. Pulmonary lab is fascinating. It's an application of scientific principles, gas laws, for example, and flows and turbulent flow and laminar flow, all that stuff, and measured in the pulmonary function lab. A practical thing about pulmonary function testing, it's pretty much a Monday to Friday job. So let's be realistic. Depending upon your personal situation, your home situation, you may not want to work night shifts or weekends. And the PFT lab, there's no such thing as an emergency PFT. That's what my pulmonary lab director says. That's why she gravitated to the lab. So it's a popular place to be.
It's usually 9 to 5, right?
9 to 5. It's
9 to
banker's
5.
hours. It's one of the few things in medicine that truly has banker's hours. Any questions about that? Okay, we can move on.
Let's see,
RPSGT.
Ken, do you, oh, either way, yeah.
You want,
Ken
Sean,
O'Gara.
you want to take this?
It's happened to be a special area of mine, so let me talk about it.
Yeah.
There are really two ways to get into sleep medicine, and that's what we call it these days, is sleep medicine. One of is the RPSGT exam and become an actual polysomnographic technologist, a polysomnographer, as we say, which just means the multiple measurements during sleep, brain waves, respiratory efforts, airflow, oxygen saturation levels, all those things. So that's one approach. There is another approach, and I've actually got several graduates who've done this. It's the SDS, Sleep Disorder Specialist Examination, which is actually offered by the NBRC. And what we're seeing is that that credential today is being recognized as essentially the equivalent of RPSGT. The reimbursement is the same. Reality of sleep lab. Let me just ask you guys, what do you think the disadvantage of sleep lab is and why some folks decide against it? Nobody wants to take a shot? Well, folks, you have to do it at night. The sleep
When do you
lab,
work?
the sleep lab is graveyard work. Only the director of the sleep lab is there during the daytime and, doing quality assurance and reviewing scoring. They call it scoring studies. But if you're a polysomnographer, you have to work nights. That's when people sleep. There's a thing called a nap study, but it's not very helpful. So we pretty much do a 6-hour overnight sleep study. All right, we could probably move on.
Asthma educator, certified asthma educator. The designation is AEC. You don't have to become an RRT, okay? It usually stands by itself. You have to take an exam that's given by the National Asthma Educator Certification Board, or NAECB. And are courses that you can take that will help prepare you for it. I took the exam. It is difficult. I think much more difficult than the TMC. You really have to know everything about asthma, the causes, treatment, management, and also the, what would you call it, the person's background. So they'll take a look at where a person, where their home, whether it's, say, from India or Mexico or somewhere in Europe or Asia. They look at the traditions that are in a particular nationality, and in terms of food allergies that would trigger certain sensitivities and so forth. It's a very difficult exam, but if you pass it, you have to get a 70% to pass. You can then use the credential AE-C after your name. And there's the AARC, the American Association for Respiratory Care. They have some career information and how to prepare for the exam. But if you're going to be working with asthma intensively in a clinic or in a hospital or in home care, it probably would be a good credential to obtain. You do have to renew it I think it's every 7 years, and you have to have, I think it's 30 CEUs that pertain to asthma management or diagnosis or treatment. Any questions?
No,
Nope.
not yet.
I have a comment.
Any comment?
Yes, so my son was diagnosed with asthma since birth, but they really don't diagnose it till they're 5 years old. But the
Yes.
doctor, when he tested him for allergies, he had no allergies to food or any type of other allergies, seasonal, pet, dander, anything. Is that common?
Oh, there's actually two types of asthma. One is extrinsic. That's the outside. That's the allergies, pollen, dander, what do you call it? Food allergies, and that will trigger an asthma attack. The other one is intrinsic, and that can be caused by emotion, stress, laughter, crying, fear, or exercise-induced asthma. So one is the internal triggers, and the other one would be outside. So it's extrinsic or intrinsic. And they do the testing to find out what the triggers are. Now, some children have it until about puberty, and for some reason, because of maybe changes in the hormones, they actually will outgrow the asthma. But it can reoccur later on in life. There's no guarantee. And there's also no guarantee that if they attain a certain age, usually like 12, 13, 14, or 15, that it's going to go away. Now, you can have your entire life asthma free, and then they have what they call late onset asthma later on in life when you're 50, 60 years of age, again, because there's a change in your immune system. And you may become sensitive either to food or dander, pollen, or it could be stress. It could be the internal form or the external form. Yeah, there's a lot about asthma that we're beginning to get a handle on. And if you watch the TV, the commercials, they call it eosinophilic asthma. Individuals who have high eosinophil counts. And that contributes to asthma. And they have those biologics that they use now to help better manage that particular type of disease. All of this are things that you would have to know for the exam.
That makes sense. Thank you for clarifying that.
You're very welcome.
Well, speaking of the intrinsic asthma, I had, as a child, the exercise-induced asthma. And gratefully, about puberty, I grew out of that. So, hopefully that will be the case for your son and as well.
Yes,
I'll talk a little
you.
bit about case management. Oh, certainly. I wish the best for him. I'll talk a little bit about case management certifications. This is a world that I live in each day. I set up case management networks around the country. And a couple of things that are remarkable here. You can be a fellow as an RT of the American Academy of Case Management, FAACM. So only licensed health professionals may apply. You'd need your RRT to be able to do this. You do have to have a pass score of 70% on their credentialing exams. So something to look into. We are increasingly seeing case managers or RTs as case managers. It seems like traditionally we typically think of case management as RNs or social workers, discharge planners in hospitals. But what we're seeing is the increase of bundled payment for care improvement programs. That's where the hospital has responsibility for the patient, not just while they are inpatient, but for a whole episode of care, 90 days post-acute. And so because they have that interest, they want to make sure the patient has everything they need. One of the clinical episodes that the hospital can sign up for with Medicare is COPD. And so I've actually helped a couple of RTs in the country get hired specifically for these bundled payment programs and to be the COPD case manager. It just makes more sense to have the RT as the case manager for COPD than to have that managed by an RN.
I'd
So if you
love
have
to
that
hear that.
certification,
That makes sense.
yeah, it's really coming aboard more. And you know, the other place we're seeing that is ACOs, accountable care organizations. If with a bundled payment, the hospital has responsibility for a short 90-day period of time post-acute, with an ACO, in contrast, the hospital, or it could be a health system, has responsibility for the longitudinal care of the patient, the total cost of care, TOCC as they put it. So ACO is really, you could consider this a population health model, where the accountable entity, the hospital or health system, is taking total care and total responsibility. They have a target price that they need to hit. You're also seeing more RTs coming into case management in Medicare Advantage plans. It's the same principle, it's the same mechanics and vehicle, where there's a total cost of care, a fixed amount of money that the insurance company is getting each year. And so they want, by nature, to make sure that the patient is utilizing healthcare in the most appropriate manner possible, that they're getting the preventive care they need. And certainly, there's just so much that can be done preventively versus somebody acutely exasperating and presenting at the ER. So bear this in mind. This, as you're thinking about where to take your career, case management is a good way to go. One parenthetical note I just want to put at the bottom, and that's why this is in italics. There are other certifications that are more common to case managers. You'll often see your discharge planners at the hospital with a CCM behind their name, Certified Case Manager. Also, they're about 90% market share. 10% market share is about the American Case Manager. Sometimes you see RN-ACM or -CCM. Know that those are specifically for RNs and social workers, but it is not a barrier or a hard stop. As an RT, you can get a fellow, that top bullet, you can be a fellow of the American Academy of Case Management. I love case management as work. I work with case managers every day, and to be able to make a difference in the life of somebody and to be caring for them, making sure that they have every need that they have.
Did we lose you, Sean?
Social. Oh, can you hear me? Is my audio okay? Hello?
I can hear you,
I
Sean.
Can you hear
I
me?
can hear you.
I can hear you.
I can hear you.
Oh, okay, good. Very good. Might have lost my audio there for a moment. So I'm glad we could touch it base into this.
You're
Tisha,
in and
Carmen,
out,
do you
Sean. I
have
don't
any
know if
questions?
anyone can hear me.
Oh, okay. Hopefully my audio is
Can you hear
okay.
me?
Can you hear me?
Yes, actually, I can hear both of you. I think Professor Wyckoff maybe
Carmen,
is losing
Tisha?
you.
Yeah, I can hear you.
Yes,
Okay,
we
good.
can hear you.
Okay, good. Well, I'm glad
Okay.
my audio's coming through. Tisha, Carmen, do you have any thoughts, questions about being an RT case manager?
Well, it's
No.
funny that you're saying this tonight because of the whole COVID situation, I was actually looking into, I needed to find a different avenue besides bedside.
Mm-hmm.
So you're giving me really good information right now.
Yeah, absolutely. This is a way to use your knowledge and skills, but not be right at the bedside, you know, if there are reasons that you shouldn't be, you know, during a pandemic. So that makes perfect sense. Yeah.
Thank you very much for all this information.
You bet. And feel free to reach out to me at any time. I'm glad to talk through the COPD RT case managers that I work with, what that workflow looks like.
Okay, great.
Let's see, Daryl, would you like to take us through consulting and teaching as an avenue?
Yeah. That's me, what you're talking about right there. That's what I do.
Yeah.
I had quite a career in hospital administration. I moved up to be director of respiratory therapy and then vice president and then CEO. And I did that for about 25 years. And what I will tell you about being the CEO is that I'm glad I did it and I'm glad I don't have to do it anymore. So what I found
Mhm.
that I absolutely love to do is teach. I love to teach, and also I consult with 3 small hospitals here who have very limited access to respiratory therapy, and I just help them to make sure that their doctors and nurses are doing things correctly for their patients, at least until they stabilize and transport to a place with a full staff of respiratory therapists. So that's the consulting piece, and the teaching piece can be either on ground or online. And I actually do a little of both. Working for medical device manufacturers, I know some RTs who have great jobs training people on the new equipment, whether it be a new ventilator, new monitoring system, any kind of technology, but they just go to the hospitals, do the training, and they're very well rewarded, compensated for doing that. So yeah, those are good options. I think we could probably move on. Any questions about that?
No, none.
Nope.
No.
Okay.
No.
Okay, I'll take this one. So as an RT, you can have many work settings. As the slide shows you, you could be at the bedside if that's your calling. You could work in a long-term care facility or skilled nursing facility or nursing home, or outside of at a rehab center. Home care, I wrote the chapter on home care for the Egan's of fundamentals of respiratory care, and also rehab. This is DME specialist. You go into the home, you set up the ventilator, you set up the CPAP, BiPAP, or the high flow oxygen therapy device, and you teach the patient and the family. So you're really a patient educator, and you have to know your equipment. You have to realize that when you're in the home, you can't just pick up and say, I need somebody come and help me. Usually it's by yourself. Now, of course, if there are questions, you always call the prescribing physician or healthcare provider, but you have to know your equipment. Sleep study clinics and doing the setup in the home for CPAP and BiPAP. Again, you could work usually in the evening, though I've seen some sleep labs that actually have people come in and they'll do titration studies, how much CPAP or BiPAP will be needed. Sometimes they can do that during the day. Case management, as Sean covered, teaching in a college, or sometimes you can work for a equipment manufacturer or a pharmaceutical company with the inhalation drugs. That's teaching the physician, the nurses, the respiratory therapists, and consulting. And there's also things they call flight therapists, respiratory therapists that will transport a patient by air in an airplane. And I'm trying to think of the different research. You can work in a research lab also on different medications or equipment that is being developed. Because you saw with COVID, they used the GM plant to make ventilators. And they actually constructed ventilators on the assembly line at some of the automotive companies. So, I mean, there's many options. So, and the payment, depending on where you live, you can really make a lot, you can do well. Respiratory can be very, very profitable. You not only feel good about yourself because you're going to help patients and their families, but you're also going to be able to take care of yourself and your own family. Anything that you want to add, Daryl or
I think
Sean,
you covered that
any
very well,
questions?
sir. Very well. Yeah.
I mean, by the way, you don't have to work in one setting. You could be a therapist that works in a hospital that also is involved with home care. Or you may be an adjunct teacher at a community college. Maybe on your day off, you may do clinical. So there's many things for you. Okay.
Well, Tricia and Carmen, we are really glad that you've joined us tonight. And we do want to leave you with a question for our future topics. We do this meeting the second Wednesday of every month. These are some ideas that we have that we can cover. But we also want to ask you, we want you to drive the content as much as possible. What are topics that are needful for you, that are kind of, burning platform, things that you would love to learn more about?
I need to think about that. Let's see.
So I'm like, I can't think of something right now.
Yeah.
Yeah, he has, if you can see the slide,
Yes.
job interviewing skills. It could be how to write your resume, communication techniques, leadership, professionalism, whatever you want. You let us know. We'll be glad to accommodate you.
Okay.
Okay. No, I like all that. And the information I didn't know a lot of the stuff that you just showed on the slide is very helpful and helps me, sort of gauge where I want to go.
We're glad
Well,
to
I'm
hear
glad
that.
the content was helpful. Yeah, we want to provide you as much useful information, translational to what you do each day as possible, not just the didactic, but the real world. So we want to thank you for attending. We really, again, appreciate you being here, Carmen and Tricia and Tisha. And we'll look forward to hopefully you can seeing you next month if you can attend on the second Wednesday. We do have the Facebook page as well as emails where we put out the reminders. And then feel free to contact me. You can text me or email me anytime. And
Okay, great. Thank
My
you so
audio
very
just gave
much.
out, so
All right. Yes.
wanna-
Thank you so much.
yeah.
I like the
thank you for being
Facebook
here.
page. It's a lot of good information on that Facebook page too.
Perfect. We're
We hope
we're
to see
grateful.
you next month. And folks, be well and be safe and be healthy.
Same to you.
Thank you. You too.
Thank
Take
you
care.
all.
Thank
Bye-bye.
you.
Bye-bye.
Thank you.
All right. Thank you all. Have a good night.
You too. Good night now.